Heart no the bed. Break you in then.
Hey guys, welcome to my channel. So I just wanted to do a more simplified version of what the media never explained about GRB's health, and I hope this version is way less technical and way less boring than the last one. I'm still trying to find my rhythm with these type of videos, so please just bear with me. I just really feel passionate about this topic, as I'm sure a lot of you are, because I really believe a lot of these treatments were necessary and that most of GRB's issues were legitimate to some degree. So I'm sure most of you already know that GRB has a microdeletion, or maybe you're just now discovering it and you're wondering how it relates to her case. Well, for those of you who don't know, she was formally diagnosed back in 2011 with microdeletion 1q21.1. Back then, only about 46 people were known to have this disorder and were studied. I believe this is one of the most important topics of her story, because a lot of her narrative hinges on that of medical misuse and MBP. So microdeletion 1q2.1 was formally studied and acknowledged in 2008 by the New England Journal of Medicine and had fewer than 50 people that presented with symptoms at the time. And 1q21.1 is a rare genetic chromosomal disorder where pieces of chromosome 1 are missing in each cell. This can lead to many different symptoms, from behavioral issues, craniofacial abnormalities, heart issues, musculoskeletal problems, the list just goes on, usually without a single trait defining it, because depending on how the symptoms manifest, which can differ from person to person, it can lead to symptoms that cause issues secondary to the microdeletion, meaning symptoms that do present or show can have somewhat of a domino effect. So here are the most commonly presented features of the 1q21.1 microdeletion. And this symptom list is from simonsearchlight.org, which they also happen to have a Facebook page. And most of you may remember not too long ago that GRB actually joined the support group and basically just downplayed her symptoms, kind of like she was trying to flex or something, but that's another topic for another time. So here's the symptom list. We have low muscle tone, global developmental delay, intellectual disability, small head size, poor growth, behavioral issues like aggression, attention deficit disorder, sleep issues, autism, seizures, vision issues, hearing loss, joint laxity, mild but non-specific dysmorphic facial features. So I'll just be addressing or going into detail for the ones that directly tie into GRB's case. So one of the symptoms listed here is low muscle tone. So an easy explanation for hypotonia or low muscle tone is to think of normal muscles as a rubber band that's tight, and low muscle tone or hypotonia as muscles that are too relaxed, or a rubber band that is too loose. A loose rubber band can't sustain tension like a tight rubber band could, and this is essentially the same for loose muscles. This leads to muscles tiring really easily. So that is what hypotonia is. This is why someone can have hypotonia, but their strength not be affected. Like, of course, depending on the severity, they can still walk, run, jump. They just get tired more easily because their muscles have to work a little harder to initiate and maintain posture and movement. And people with hypotonia may be a little clumsy as well. Now, hypotonia can be caused by a few things, but it's usually rooted in something neuromuscular or chromosomal. Hypotonia can also affect other muscles in the body, like the eye muscles, GI muscles, lung muscles, and the heart. And before I forget to mention, I also want to add that a muscle biopsy for hypotonia caused by a chromosomal disorder often shows up normal. I'll go ahead and drop the source for that. Next is joint laxity. So joint laxity is having to do with the connective tissue also being too loose. Joint laxity allows joints to move around more than they should, and this means they aren't as stable as normal joints. Not only does joint laxity affect the joints, but it can also cause heart issues, since the heart is also made up of connective tissue. So again, real physical activities like walking, running, jumping, this could increase the risk for injuries or discomfort for someone with this symptom. So these are only a couple of symptoms I've gone over so far, and I hope you can all see what I mean by the chromosomal deletion symptoms causing a domino effect. Like, one seemingly small issue can just manifest into a lot of issues. Now, let's look at small head or microcephaly. I think the definition of microcephaly is pretty self-explanatory, but I just want to highlight that even moderate cases of microcephaly can be linked to various issues. One of the main issues being a small jaw, aka micronadia or retronadia. So if the jaw is small and the tongue is normal size, the normal sized tongue can actually be too big for the jaw and cause issues in itself. The formal name just kind of kept messing me up, so I'll just go ahead and drop that below so you can see what that is. But a small jaw can also cause all sorts of issues with chewing and swallowing. Another link to moderate microcephaly can be a high arch palate, which is basically when the roof of the mouth is elevated. This can cause eating and swallowing issues as well, since a high palate can cause orthodontic issues. If the teeth can't align properly, the teeth aren't able to effectively grind food, or if it's a baby that has a high palate, it won't be able to latch properly, leading to feeding issues and poor food or drink intake. This can also affect breathing since the roof of the mouth is right below the nasal passage, and it does this by narrowing the nasal passages. So poor growth or failure to thrive is another symptom, and this links back to microcephaly caused by the microdeletion. So since we know microcephaly can impact jaw formation, oral palate, orthodontics, and the ability to grind food, if you compound this with hypotonia, which can also affect swallowing, then we see how this could impact food intake, which in turn affects weight and growth, leading to a failure to thrive. In these types of cases where poor intake is impacting weight and growth, a feeding tube could be implemented. Again, like we were saying before, a domino effect. Our next one is sleep issues. So for GRB, she was noted with hypoventilation, and I'll say possible sleep apnea, and only possible because I haven't been able to find it explicitly stated in the medical records, but I can say for certain that she did have hypoventilation from a preliminary study, and I believe also a sleep study. So in her case, I believe hypoventilation while sleeping is linked back to her hypotonia, because remember, hypotonia can affect all muscles, and this includes the diaphragm, which is a muscle below the lungs that allows inhaling and exhaling. So hypoventilation can lead to CO2 buildup in the blood, and if left untreated, can lead to symptoms like headaches, confusion, shortness of breath, and in severe cases, seizures and cardiac arrest. A BiPAP or a CPAP is usually used to mitigate these symptoms or prevent complications like seizures or cardiac arrest. Our next one is strabismus, and strabismus is another symptom of 1q21.1. And this is another obvious symptom that GRB has. So strabismus is when the eyes don't align properly. And there are a few causes for strabismus, but most notably, it can be caused by poor eye muscle control, which again can be linked back to the hypotonia or nerve issues or even cerebral palsy. Maybe YDD was saying GRB had cerebral palsy, but I don't know. In GRB's case, her strabismus actually developed into amblyopia and required her to have around 4 eye muscle surgeries just to get her eye to where it is now. If left untreated, amblyopia can actually lead to permanent vision loss. Hearing loss is another symptom of microdeletion 1q2.1. In GRB's medical records, she actually had a lot of recurrent ear infections. So recurrent ear infections are notably caused by eustachian tube blockage or inflammation. And I bring this up because GRB was actually seen by ENT multiple times, as well as an audiologist, and she was actually diagnosed with SHL of the right ear. I also want to highlight that these complaints came out of her own mouth, with her stating that her hearing sounded fuzzy. She underwent multiple PE2 placements, which is a procedure to help drain fluid from the middle ear. And it should be noted that recurrent ear infections can also be linked back to microcephaly and craniofacial structure. Moving on to mild but dysmorphic facial features. Mild but dysmorphic facial features are subtle, non-typical physical traits like epicanthal folds, micronathia, deeply set eyes. You get the picture. And another symptom is seizures. Now, I used to be on the fence about this one until coming across a medical record on one of her, I call them mockumentaries. And literally all parties involved with this so-called documentary, including past attending physicians, just completely disregarded this nugget right here. This record shows in plain sight that not only did she have a small syrinx on her thoracic spine, but an EEG with spike and wave activity in the right central temporal area of the brain. This could support and be indicative of a condition known as self-limiting epilepsy, which is typically outgrown during the teenage years, and I'll drop a source right down here. And lastly, behaviors like aggression. Again, I think this one is pretty self-explanatory, but I think it's also fair to say that it's quite obvious that she has some mental and behavioral issues despite her masking. I know she's been pretty open about her use of Wellbutrin, again, like it's some sort of flex, so clearly there's something going on there. So that's my deep dive on what the media never explained about GRB's health. I hope this video was informative and more enjoyable for you to watch this time around. If you made it to the end, just know that I appreciate you. Feel free to share this, like, subscribe if you want to. No pressure. Thank you for watching and take care.